Welcome, everybody. Glad you could join us tonight. Welcome to the March meeting of our nonprofit plant-based nutrition organization of Wisconsin, or like we like to call it, PBNOW. I'm your host, Terry Lynch. The mission of our nonprofit group is to educate, inspire, and support each other on an evidence-backed, whole plant food-based nutritional path for a healthier, happier life. Our group is open to everyone, those plant-based and those just curious about it. It's meant to be a non-judgmental place to get information, inspiration, and support. If you'd like more information about our group, our upcoming meeting dates, speakers, and resources, or to check out videos of our past meetings, just Google us at pbnow.org. That's pbnow.org. As we mentioned at the beginning of each meeting, the evidence of the benefits of plant-based nutrition in improving health and quality of life for people of all ages, as published in non-biased medical research, is quite striking. Whether it's improving health through increased energy, weight loss, preventing, slowing, stopping, or reversing problems like allergies, digestive problems, diabetes, heart disease, and early dementia, or increasing our quality of life by helping us to feel better quickly, strengthen our immune system, increase our endurance, improve athletic performance, speed recovery from exercise, reduce joint pain, clear thinking, or reduce the physical, emotional, and financial side effects of the illnesses, drugs, and procedures often recommended to treat the conditions that plant-based nutrition can help us avoid. The research shows our bodies do a wonderful job of healing themselves if we stop damaging them daily with poor nutrition and start giving them the nutrition they need to heal and function optimally, so we can have a better chance to enjoy each day of our lives. It's truly remarkable. It's my pleasure to introduce to you tonight our featured speaker, Dr. Sandra Musial.
So the name of my talk is Food is Medicine, Choosing Wisely to Optimize Health. And I've rearranged all my slides and added in new ones, especially for the Plant-Based Nutrition Organization of Wisconsin. Love your name, PBNOW. It's very catchy. Let's see. So this was what you just heard, kind of my short resume. And I just wanted to throw out a shout out to Lifestyle Medicine, which was my most recent board certification that I got just last winter. And for those of you who don't know, it's one of the newest branches of medicine where you can get board certified in addition to a primary board certification. So you could be a pediatrician or an internal medicine doctor or a cardiologist, and then additionally get training in lifestyle medicine. And lifestyle medicine incorporates 6 different areas of wellness, including nutrition. I think is kind of the biggest part of it, but maybe it's because that's my mindset. This is all based on, evidence-based medicine. So it's educating people on a whole plant-based diet, increasing physical activity for wellness, developing strategies to manage stress and improve mindfulness, form and maintain positive relationships, enjoy restorative sleep on a nightly basis, and avoid risky and addictive substances. That's kind of the summary of lifestyle medicine. And so Terry had asked me, where did this all come from? So just a little background about how I got into food as medicine. So this old photo is my father and his 2 brothers, who are all World War II veterans. My dad is on the bottom left, George, and his brother Mike died of a heart attack when he was in his 40s suddenly. And it really affected my father, who decided to, educate himself on this. He was an engineer. He was very methodical and analytical. And he started prescribing to this magazine we had back in like the early 80s, 70s called Prevention Magazine. I don't know if you guys had it out there, because I think it came out of Harvard, but I'm not sure. And we started doing stuff like giving up red meat and taking the skin off the chicken and, not having butter. and it just made me aware that there was this connection between nutrition and health. So that's what led me to study nutrition in college. And the picture on the right is my dad and his brother, John. They both lived to be 94. And there's a stark difference if you really look at them. They're a year apart in age, but John looks considerably older. He's holding a cane. My dad's kind of holding him up. And John didn't know who we were and, had had multiple strokes, and was very cognitively impaired. Where my dad in this picture, they were both probably about 90 in this picture. My dad was sharp as a tack and had worked full time as an engineer until he was 88. And this kind of illustrates this concept that I just want to start out with called compression of morbidity. Morbidity is like all the bad medical stuff that happens in life, like getting a diagnosis, going on medication, having yucky symptoms, being in a hospital, having a surgery. These are all morbidities, stuff you want to avoid and not have at all. So the top timeline shows the SAD, standard American diet, timeline. Someone were to eat just kind of unhealthy foods full of processed foods and oils and sugars and animal products. Around 50, almost, predictably, people start to have elevated cholesterol, a little blood pressure creeping up, extra pounds around the waist, maybe a diagnosis of diabetes. And this is the triangle is showing all these morbidities. And with time, you get more and more and more morbidities. They don't go away. They just get kind of treated, and then it results in an early death. The second line represents the standard American diet plus medical intervention, which is what I've kind of witnessed during my 30 years as a physician. The morbidities don't get any better. The quality of life doesn't get better. But with medical intervention, we have medications and surgeries to prolong life, but not necessarily improve the quality of life. And the third line represents a healthy lifestyle, this kind of lifestyle medicine approach where people have more time living, less time dying, and that morbidity is compressed into the very end of life. So when you hit 50, you're not getting morbidities or diagnoses, and hopefully you're living a long, high quality life. And my dad kind of exemplified that, and this just shows a close-up of their faces, the vacant look in Uncle John's eyes. He had no idea who we were, um, and the difference in their skin. And they both died at 94, but very different lives. Uncle John was fed in a hospital bed for, I think, 18 months to 2 years at the end of his life. And my dad lived, complaining and talking about things and, analyzing everything until the very end. So my introduction to, from kind of traditional medicine into this plant-based arena was the China study. That was my gateway book. I read it in while I was a primary care pediatrician, and I it really blew my mind. I was really shocked at what I didn't learn in medical school about nutrition, and this seemed like really important new information that really wasn't getting disseminated. And this is a shameless picture of myself and my sister and my niece with Dr. Campbell when he was at Kripalu doing a weekend retreat, which really for me solidified. He was there with Dr. Caldwell Esselstyn and Caldwell's wife, Anne. It was the three of them doing this amazing conference. And yeah, so you guys are so lucky that Caldwell's coming next month. So the first thing I did was I bought like 10 copies and I gave it to my brother who's in this picture, my other brother, my sister in the back seat. Everyone got a copy. My father-in-law, my father, and my brother on the left happened to be, I didn't really even know because he lives in Colorado. He had gained a lot of weight. His doctor has told him, you need to go on Lipitor and blood pressure medicine. And then his neighbor died of a heart attack, and he was just ready to receive this book. And on the left is his kind of before picture, and he was a lot younger. He was probably only 40 in that picture. And then on the right is him just a few years ago with my mom, just He lost weight. He never needed any of the medications. He just got in incredible shape. Just last summer, he hiked the Colorado Trail. And so his success story, just by giving him a book, kind of blew my mind and said, this is fun. I mean, I loved pediatrics, don't get me wrong, but I just decided I need to somehow pivot from pediatrics into helping people eat better to reverse their chronic diseases without going back to a residency program. And then this is the other side of the coin. This is my friend Rich. We were on a vacation in the British Virgin Islands sailing, and he didn't really want to address issues. He didn't want to hear about it. He had untreated hypertension and high cholesterol, and he died a month after this picture was taken at the age of 55. And it's infuriating to me that, had he known, I'm sure he would have changed the way he was living his life. So that is my mission now. So the food you eat can either be the safest, most powerful form of medicine or the slowest form of poison. And those two cases that I just talked about kind of exemplify the two opposite ends of the spectrum. So, this quote, the food that you eat can either be, medicine or poison. Well, what is food? So these are a couple definitions. A food is a product eaten regularly by a group that has recognized its harmlessness and long-term benefits for health, or any nutritious substance that people or animals eat in order to maintain life and growth. So of course I highlighted what I kind of have a problem with most of the food in the supermarket. Is it really food? So I think of the food that we ingest as a spectrum. And one of the tools we use when we teach people are this A through F. We have A foods that, are whole plant foods that are unprocessed, that are fighting disease. They're fueling our cells to give us optimal health. They're anti-inflammatory. They're anti-cancer. They're anti-heart attack. And then the other end of the spectrum is doing quite the opposite. They're pro-inflammatory and are setting up a milieu in the body for disease states. So of course it's a spectrum, right? Everything we eat is somewhere between. It's not just A or F. So I feel like what I explain to people is you don't have to eat A foods all the time, but I try to move people in the direction on that spectrum for more of these A foods in their life, more A and B foods. So every day, over 50 billion cells die and are remade. And so I like to look at this. Here's an opportunity. No matter where you are in life, no matter what your age or how many crappy cheeseburgers you've eaten in your life, there's a chance every day to kind of start over. Because of these 50 billion cells, where do the building blocks come from that make up these cells? It's not about percent protein and carb and fat. It's about what are the ingredients in what you're eating? What are the phytonutrients, the vitamins, the minerals, the gifts that the foods we're eating provide? So that's the whole field of food as medicine is thinking about food. And I do think about this probably to a fault of what is this food doing for me, and how it can take the place of medicine. And I love to help people get off their medicines and avoid needing to take them. But it can be confusing if you are a Lamborghini, or even if this is your car, you would never put soda in your fuel tank. But humans, it's much more confusing. There's all kinds of books and headlines and fad diets, and even the government, billions of dollars with lobbyists, influencing the RDAs and what we're learning. No wonder people are confused. So of the 2 million species on the planet, only 3 have a problem with their weight. So if you were a live audience, I would have everyone shouting out, dogs and cats and humans. Right. So It's incredible though, if you think about all of these species in the wild, they really don't ever get obese. Very rare. So these are some recent obesity maps. The column on the far right is, I know it's tiny. It says severe obesity, meaning a BMI over 35. And the column on the left is overall obesity. And this is showing from when I started as a doctor in the 1990s, they're yellow, which I blew up the little prevalence percentage rainbow. So that was like around 20%. In the 2000s, it's orange, 30%, 2010, 35%, 2020. So now we're in the 42.5% of Americans are obese, and they're projecting the bottom map is 2030 to reach, some of those states are 60%. And severe obesity has doubled since the year 2000. And also during the time I've been a physician, this is what's happened with type 2 diabetes, which is closely and very intimately linked with the obesity epidemic. 1 in 10 Americans have diabetes, 1 in 3 have pre-diabetes, which is like the warning. Your A1C is creeping up, but it's not yet diagnosed as diabetes. And heart disease, the #1 killer in America. Everyone knows somebody who's died of a heart attack. Every 4th death is due to cardiovascular disease. And the cardiovascular disease is the leading cause of death in diabetics. So these things are all intricately linked together. So when I look at all this, I feel like, wow, even though there's all these advances in medicine, we are failing at treating chronic diseases. 47% of US adults have hypertension. Every year, 795,000 Americans have a stroke. So, what I've witnessed is everyone is just lining up in this pills and surgery line, and there's very little change going on in medical schools and residencies, physician education, and with reimbursements to discuss lifestyle changes with patients. So nobody's in this line, or not many. So here's a patient of mine, Carol. She arrived for one of our jump starts. It's one of our month-long programs that we run. And she walked in and she had a blood pressure of 200 over 110. She also had some obesity and a high LDL cholesterol, which is the bad cholesterol. My partners were like, should we send her to the ER? Like she was coming in for this community program, which is actually held in the cellar of a plant-based food hall. We weren't like at a medical center. And she was like, I'm not going to the ER. I've tried all these different medications for blood pressure. I don't like them. They're terrible side effects. I want to do this. I want to do whole food, plant-based nutrition. So after the month, her blood pressure was 180 over 90, going in the right direction. And 3 months later, she sent me this picture, and her blood pressure was 112 over 70. I think I cried. It's just incredible, the miracle of food. However, most physicians are treating medical conditions with pills, and really not enough emphasis is placed on the power of food to heal for hypertension, high cholesterol, type 2 diabetes. And then the surgeries, we do 250,000 sleeve gastrectomies for obesity, which is the surgery you see on the bottom. And on the right, they're doing a coronary artery bypass graft, a CABG surgery, 250,000 of each of those per year. So this is just what I've seen. As physicians, we're providing sick care. It's not healthcare. At the hospital, it's for sick people. They're not. There's no money in this kind of well care that I want to do. So sick care is just this damage control, reactively managing sicknesses that are a result of poor lifestyle choices, where healthcare is more wellness, proactively creating true health by preventing disease through healthy lifestyle choices. So there's a few metaphors here. After 30 years in mainstream medicine, I felt I was at a fork in a road, and I left mainstream medicine and started my own nonprofit to educate people about plant-based nutrition. But also, for people that are my participants, they're too at a fork of the road. Like every time you eat, you have a choice. Do you want to eat something that's going to give your body gifts that is healing? Or do you want to eat something that's inflammatory that will, could make you sicker? So if there's a choice between pills, surgery, or eating food, to me, it's kind of a no-brainer. So this is my job to convince everyone to get in the lifestyle change line to improve health of our country. So to understand some of the science behind it, it's important to understand dietary patterns. There's different kinds. It's very hard to do nutrition studies, right? Like ideally, you want someone to eat one way and only one way for their entire life, and compare it with someone that's exactly similar and has the same exact life, and then eats a different way. And you can't do that. So we have to look at dietary patterns and population studies. So everyone knows what the standard American diet is with, you know, sugary, processed foods, oily animal products. Healthy US diet means you take the skin off the chicken, you have skim milk. Mediterranean diet, there's more legumes, whole grains, more fruits and vegetables, but it still includes poultry, fish, and some cheese, and lots of olive oil. And a plant-based diet, we're taking out the animal products, way more kind of plant-based proteins, plant-based milks, whole grains, minimizing oils, and lots of fruits and vegetables. However, we also need to understand the difference between plant-based, whole food plant-based, and vegan, because a vegan diet is absolutely eliminating meat, poultry, seafood, eggs, and all animal products like religiously, but they could be eating oils and fried foods and processed grains. So a plant-based diet or a whole food plant-based diet is really focused on whole grains, fruits and veggies, starchy veggies, legumes, and minimizing the oils, processed foods, and the animal products. So a vegan diet could look like this, which in studies would not, be favorable for reversing cardiovascular disease and diabetes. So let's look at some of the studies. The World Health Organization has reported that 80% of heart disease, stroke, and type 2 diabetes mellitus and 40% of cancers could be prevented with lifestyle changes. This was a study that came out in JAMA, which is like a very reputable journal, looking at a whole bunch of studies and showed that poor dietary choices are the #1 contributor to death in the United States, looking at the 17 leading risk factors. So this was a very important study. Looking at specifically coronary artery disease, the coronary artery is the blood vessel that feeds your heart muscle itself. So when that gets blocked off, that's what a heart attack is. The heart can't pump anymore. So Caldwell Esselstyn wrote Prevent and Reverse Heart Disease, and Dean Ornish wrote Undo It. And these two, 30, 40 years ago showed that you could reverse coronary artery disease with a low-fat, whole food plant-based diet. So this was the Dean Ornish trial, and the graph on the right shows the amount of stenosis, so the amount of narrowing of the coronary artery. So the solid black dots are showing that on a regular diet, it's getting narrower and narrower over 1 year to 5 years. But those on a low-fat plant-based diet, it actually, you see less stenosis. And so there are now Dean Ornish centers all over the country. We actually have one in Rhode Island. They're intensive cardiac rehab programs that also incorporate some of those lifestyle medicine principles that are so important, including stress and activity and relationships, in addition to diet. Caldwell Esselstyn was featured in Forks Over Knives, and he did this study years ago with people with very, very, very advanced coronary artery disease that there was no other medical treatment for them. And he basically like brought them home and fed them and said, if you want to stay in the study, you have to eat this very strict, low-fat, whole food plant-based diet. And he showed that of all the lesions in the coronary arteries, that there was regression of 11 and 14 remained stable. And of the people that dropped out, they had progression of disease. So this is what we're talking about. This is dye in the coronary artery, and you can see the narrowing here. The blood's trying to get past all these plaques that are blocking the blood. And after, I think it was like 2 years, this is the same person with the plaques regressed. And if you look around, there's a lot of other blood vessels too. So there's like improved vascularization and blood flow of the heart. So another population study that I love are looking at these blue zones of the world, the regions of the world where the greatest number of people live to be over 100, which has become popular because of the Netflix series Live to 100. And I think you guys had Dan Buettner come and speak to you. He's a really great speaker. But there's some important studies that have come out of these blue zones. So this was out of Okinawa, Japan, and it's looking at mortality rate from coronary heart disease and certain cancers. The black is the Okinawa Island blue zone. The white is Japan, and then the gray is the United States. So coronary artery disease, heart disease, death from, look at the top, this gray, it's like off the chart. That's a 100. So it's really like way off my computer where the top of that bar would be. But these are significant differences between colon cancer, prostate cancer, breast cancer. So it's important work. And then these next two studies are from Loma Linda in California, where there's a lot of Adventists who, and a lot of Adventists practice vegetarianism or veganism. Not everyone though. So in these studies, they have comparison groups, people that were omnivores, people that were pescatarians, people that were vegetarians, and people that were vegans. And they tend to be more healthy vegans, but this was the first health study. There's like 5 different ones that have come out of there, like huge. There's like many, many, many publications, but these are 5 of the broad topics. So this was from the 70s and 80s, over 34,000 people, to figure out which components of lifestyle gives the most protection against disease. So the key findings were that men who ate beef more than 2 times a week had a significant increase in fatal coronary heart disease. They didn't see the same statistic in women. And then the next 4 points are about cancer, that high fiber intake, eating fruit, eating legumes, all were associated with lower risk of cancer, and eating meat was associated with increased risk of cancer. And then the Adventist Health Study 2 is ongoing. Over 96,000 people, started in 2002, ages 30 to 112. They fill out a 50-page diet and lifestyle questionnaire. And one of the key findings that impressed me was eating nuts 1 to 4 times a week lowered the risk of myocardial infarction, which means heart attack, by 73%. And then they also compared that spectrum of the kinds of diets. So looking at just 55-year-olds, the vegans weighed 30 pounds less than the omnivores, and also had lower cholesterol, blood pressure, diabetes, metabolic syndrome. And then this is a prettier picture showing BMI and diabetes along that spectrum. So on the left, you have the omnivores, the semi-vegetarian, the fish eaters in the middle, the ones who are still eating eggs and milk, lacto-ovo-vegetarians, and then the vegans on the far right. And look at the green numbers of the BMI, but the white numbers are the diabetes prevalence. It's almost 4 times higher in the omnivores than the vegans. Everyone thinks it's about carbs. It's not. So here's Deb, another testimonial. She was one of my patients that I met, participants in a Jumpstart program. She was from upstate New York. She went to her doctor and was diagnosed with high cholesterol and type 2 diabetes. Now look at her, right? She weighs like 100 pounds. She's like 5'2", skinny little thing, very active, hikes. So her doctor told her, this is genetic. You need to start meds. And she was like, isn't there something I could do with my diet? And her doctor said, no. Look at you, you obviously this is genetic and there's nothing you can do. But fortunately, her brother had done the Jumpstart, who lived in Rhode Island, and he told her about the program. And she called me and said, "Can I do it remotely?" Now, we had never done it remotely before. We only did it like for Rhode Islanders. But I said, "Sure, if you want to be a guinea pig with all my tech challenges." But um, she agreed. So she was my first remote participant. Labs from March of 22 showed a total cholesterol of 246 and an LDL of 140. Now we really want the total cholesterol under 200 or even lower, and the LDL under 100 or even under 70. And her HDLs are great. That's a nice high value. Her TG's triglycerides were nice and low, but her A1C, which is a marker of diabetes, was in the just over 6.4 is considered type 2 diabetes. So she was just over the cutoff for type 2 diabetes. Between October and March on her own, before she met me, she had lowered it a little bit, and now it was in the pre-diabetes range. After she did the jump start, she dropped her cholesterol just in 1 month to 165. Her LDLs dropped to 78, and her HDL dropped a little, which is okay, and her triglycerides dropped a little, and she dropped her A1C down into the normal range. She reversed her diabetes, dropped her LDLs, no meds. That's Deb. So a couple more studies. The EPIC Oxford study is a really important study out of England and Scotland because it's over 44,000 people. And it's similar to the Adventist study in that they compared non-vegetarians and vegetarians and vegans. And 34% of the participants were vegetarians at baseline. They followed them for almost 12 years. And compared to non-vegetarians, the vegetarians and vegans had lower BMI, cholesterol, blood pressure, and ischemic heart disease, like heart attack kind of stuff. So NHANES study stands for National Health and Nutrition Examination Survey that's happening in the United States. Every year they screen 5,000 people. And a recent important finding was they found that every 5% increase, UPF stands for ultra processed foods, like you see pictured, was associated with a significant decrease in cardiovascular health. So we kind of know junk food's not good for you, but it's nice to have the studies to back it up, right? And then this was a trial looking at, this was in Lyon, France. They took 600 patients who had a heart attack and they put half on a Mediterranean diet and half on a control kind of healthy French diet, whatever that means. And it was very cardioprotective. The Mediterranean diet was way better than the control. It was so effective in stopping heart attacks that they had to halt the study after 4 years because it wasn't ethical to keep the patients not on a Mediterranean diet. And like as we talked about, the Mediterranean diet is kind of the closest thing we have to a whole food plant-based diet and a lot of the trials that are going on out there. And the DASH trial is just an important one. It stands for Dietary Approach to Stop Hypertension. And it's basically a diet rich in fruits and vegetables, low fat dairy, low in saturated fats, and low sodium. And it does significantly reduce blood pressure. I would argue not as well as a whole food plant-based diet. And the women's health study is also a huge study out of the United States. More than 25,000 women followed for 12 years, measured 40 different biomarkers. And those with the highest intake of Mediterranean diet had up to 27% less cardiovascular disease events. They didn't compare it to whole food plant-based. But anything that kind of, is significant and, I'm just sharing it with you. So here's a couple just one item things that I think are kind of fascinating. Looking at blood pressure, the flaxseed study, they took 2 groups of people and they ate a muffin every morning. One group, they were identical muffins, except that in one group it had a tablespoon of flaxseed. And a month later, they had decreased blood pressure, the group that got the flaxseed muffin. I love how simple it is. And then the second study down below is a study that got published comparing hibiscus tea with lisinopril, which is like a common medication used for blood pressure, and it was equally as effective. So, and then we're nearing the end. Just these are substitution studies, and it's a meta-analysis, which is when someone looks at like all the studies that were done that fall into a certain category. So there were 37 publications that looked at substituting animal-based foods with plant-based foods. And then the outcomes they looked at were cardiovascular disease, type 2 diabetes, and all-cause mortality. And they assessed them for like how good the evidence was. So these were the kind of swaps we're talking about. Like, so it's not like going fully plant-based. It's just making swaps like bean burrito for beef burrito, lentil soup instead of chicken soup, a black bean burger instead of a hamburger, and so on. So there was moderate evidence that showed lower risk of cardiovascular disease when substituting processed meats with nuts, legumes, or whole grains, nuts with eggs with nuts, or butter with oil. All were like a positive swap out. Moderate evidence for decreased type 2 diabetes when substituting red meat with whole grains or cereals, red meat or processed meats with nuts, replacing poultry with whole grains, and eggs with nuts or whole grains. So many people think carbs are the issue with diabetes, but it's not about the whole macronutrient. It's about the details, right? It's about whether you're eating white flour or farro, two different things. So all-cause mortality means like all causes of death. There was a significant reduction when red meat was replaced with nuts or whole grains, processed meats with nuts or legumes, dairy with nuts, or eggs with nuts or legumes. So, and this was just published in November. So really important work. So how quick do you see cardiovascular disease, and diabetes switch around? So this was a study that only had 31 participants, but they were on a low-fat, whole food, plant-based diet. Significant reductions in systolic, and those are really significant, way more than the DASH diet, diastolic blood pressure, drop in serum lipids, reduction in total medication usage, and other cardiovascular risk factors, including waist circumference, weight, heart rate, hemoglobin A1C, which is that marker for diabetes, and HSCRP, which is a marker of inflammation. So it's all significant in 4 weeks. The Rochester Lifestyle Medicine Institute has a 15-day jumpstart, and they see these significant drops in cholesterol, LDL, glucose, and blood pressure. So this is not my food hall, but this is the plant-based food hall where I run my programs. It's called Plant City. If you guys ever come to Providence, Rhode Island, I want you to stop by. It's amazing. There's 4 different restaurants in there that are all vegan, not necessarily whole food, plant-based, no oil, but we do have some options. It also has a marketplace and a community space for programs. So this is where I run the live programs. But right now, because of COVID, everything is turned to have remote options for everything. So our Jumpstart Your Health program I started in 2019, created and run by 3 MDs who are knowledgeable in plant-based nutrition. We do blood work at the beginning and the end, blood pressures, weights, BMI. We do 4 90-minute group sessions. 2 are educational and 2 are cooking together classes. And then everyone gets a 30-minute consult after with unlimited kind of email texting with me during the program. And this is 2 of my partners in the community space with my favorite books. This is one of the early cohorts when everything was live, all different ages. And this is us doing remote cooking classes in Dr. Lee's kitchen. And here's the summary of our data. So the average cholesterol drop for everyone is 25, similar to the Rochester data, and 38. Cholesterol drops 38 in 1 month for people who have a starting cholesterol over 200. The LDL drops 22 points for people who have an elevated LDL to begin with. I always tell people it's not a weight loss program. This is just a side effect of eating this way. And the average weight loss is about 1 pound a week, which is optimal weight loss. I don't like to see more than that because when you lose weight too fast, it can trigger these starvation hormones that just make people eat more, and they end up regaining the weight. This is a spectrum of liver disease. Non-alcoholic fatty liver disease, NAFLD is sometimes called, is the most obesity is now the most common cause. This whole thing is the most common cause of liver failure and cirrhosis. It used to be alcoholism or hepatitis, but this is a real big problem. So this is a healthy liver on the left. Fatty liver looks like this, the second one. The next one is called NASH, non-alcoholic steatohepatitis, where it has more inflammation. And then the cirrhotic liver on the right is like a hard, it's not compatible with life, and it's fatal if a liver transplant is not done. The good news is that fatty liver and NASH is reversible with dietary changes. So risk factors for getting fatty liver is excess body weight, obesity, high cholesterol or triglycerides, diabetes, and sometimes genetics. So we're measuring liver function tests, but our numbers aren't high enough yet to show significant drops. We do see drops, but they're not statistically significant. But this is significant. This is that HSP I mentioned before, which is a marker of inflammation. And we do see a significant drop in this inflammatory marker for people who start with an elevated HSCRP. So regarding diabetes, I like to explain it as this kind of spectrum of you start to get a little insulin resistance, it leads to prediabetes, and it leads to type 2 diabetes. And those yellow blob, this is a cell with the receptor, and the receptor is needed to get the glucose into the cell. And the insulin is the key that lets the glucose into the cell. So people who have type 2 diabetes actually produce a normal amount, or, initially they producing insulin. There's nothing wrong with their pancreas. What's wrong is that the receptor, the mechanism for this receptor is not working. And it's thought that it's this intracellular fat from excess caloric intake, from excess saturated fat intake, mostly from animal products, cheeses, butters, oils, that lead to this dysfunction. And the coolest thing of everything is how quickly it can be reversed. So when you take someone off of animal products and you start giving them lots of fruits and vegetables, within a week or two, we need to adjust for people with type 2 diabetes on insulin, we need to adjust their insulin dose because their own insulin just starts working again. It's really miraculous. So during our month, we see, prediabetes reversed and type 2 diabetes improved. The average drop is 0.2%. So here's Paul. He was another Jumpstart participant, 55-year-old with a really strong and concerning family history for early cardiac death. And his father, his uncle, his grandfather. He was thin and active and was eating what he thought was a healthy diet, taking the skin off the chicken, but he had, and his labs weren't that bad. He had a total cholesterol of 219 and an LDL of 140. He was definitely a skeptic. He came in and was like, yeah, I don't think we're going to be able to budge my numbers, but he really didn't want to go on Lipitor. And he also, was very concerned about, we don't have a calcium score on him. I don't know how advanced his coronary artery disease was. But I remember he sat there kind of like this guy. It's not really him. Just skeptical. And he ended up dropping his cholesterol to 178 and his LDL to 108. And it wasn't until he got the labs back that he was a believer. And now he makes his own veggie burgers from scratch. And he's so into it. So whole food, plant-based nutrition is kind of what the gold standard for food as medicine. And, there's more and more and more research that is showing that it can prevent, improve, and even reverse all of these conditions. And it's exciting because there is more and more research coming out every week. in publications, and it is going to spread to mainstream medicine, and it's just it's painfully slow. So, you look at all these things like brain disease, infections, cancer, kidney disease, blood pressure, like depression. Like, what do all these things have in common? Well, this is work by Dr. Dean Ornish that I heard at the lecture he gave last fall. And so I love this. He calls it the unifying theory of chronic disease. And it's that all of these things have these things in common. And I could give a whole 1 hour talk just on this slide because it's so important. It's so detailed, but inflammation, everyone's heard of that. That is, underlying all these things. Oxidative stress is what is kind of toxic to cells and promotes aging. That's why foods rich in antioxidants help offset that. An unhealthy gut biome is universal in people who have some of these chronic diseases, where when you change the diet, they've done all these studies checking poop and measuring the bacteria in the poop. Like, when your gut biome shifts over like the course of a year as you shift your diet, and that results in changes in everything. And it could possibly be related to why, gene expression changes. So your genes are not your destiny. I'm sure you've heard that. And it has to do with um, just because something runs in your family doesn't mean that you're going to express that gene too. You can suppress that gene by making lifestyle changes, not just food, but also meditation, mindfulness, exercise can affect gene expression. And telomere length, like they showed in that twin study, that everyone on the vegan diet had the longer, telomere lengths at the end of the study. That was another Netflix show called You Are What You Eat, a study done by Christopher Gardner out of Stanford. So anyway, love that, all those topics. So here's just some tools. This is like one of my favorite tools that I use. I like it because it's like positive. Like, here are all things you want to try to get in your diet every day to get all the micronutrients and macronutrients you need without having to weigh or measure anything, or, obsess about what percent carbs you're eating. Like, this is just eat these foods. They're good for you. It's an app. It's free. And this is just some Plant Docs kind of reading nutrition labels. If it's Plant Docs approved, the first 3 ingredients: no oil, sugar, refined flour. That's just the first challenge. This isn't true of every product, because nuts, of course, are going to be higher in fat, so it wouldn't apply to that, but maybe a cereal or a granola bar. Look for fat. This is the 3-3-6 rule. Fat less than 3, fiber greater than 3, sugar less than 6. And here's looking for a product that's low in sodium grams less than the number of calories. If it's more, it's considered like a high sodium product. Carb to fiber ratio less than 10-1. And this is based on, if you look at the carb to fiber ratio of like a grain of farro or barley, it's 10-1. So if it's greater than that, it's more carbs that are refined without the fiber. We don't want that. So in this product, this is an example, a bad example. The carbs are 31 grams and there's 0 fiber. So that is not a whole grain. So this concept is not new, over 2,000 years old. Let food be thy medicine and medicine be thy food. I'm sure you've all heard of that. This is my garden where food should come from. And just a quick review of our programs. You've heard about the Jumpstart Your Health. That's our month-long immersion into plant-based nutrition with labs before and after, education, cooking. The next sessions coming up are May, September, and November. We're in the middle of one right now. And we also do monthly cooking classes, which is just a fun way to kind of stay connected, learn new recipes, new cooking skills. I am not a chef, so I think that's part of the fun, is that this is like anyone can do it. And it's a gathering of like-minded people with maybe learn some new spices, ingredients, or skills. And the theme this year, 2024, is healthy aging and longevity. So there's like a mini PowerPoint in there too. I also do private consults, one-on-one, remote, and we have a Foods to Fight Cancer month-long program that talks about the most powerful anti-cancer foods, and then we do a quick meal using those ingredients. I would love to have a bunch of followers from Wisconsin on our Facebook and Instagram, which is at Plant Docs PVD. PVD, by the way, stands for Providence. I just bought the domain name Plant Docs because I didn't realize how short-sighted it was. Everyone in Rhode Island knows PVD, but nobody else does. Our YouTube channel is just called Plant Docs, which I will post this on if I can figure the tech out. These are all the plant docs that help me teach and educate. Some of them teach at Brown. Some of them are in private practice. Some of them are residents. You can tell who that is on the left, younger. And anyway, we're all passionate about food as medicine and plant-based nutrition. And you can email me for anything, sandy@plantdocspbd.com. Please check out our website. There's free recipes. That's probably the best part of the website that we developed with some culinary nutrition students at Johnson & Wales, and all our programs are there too. Yeah, thank you, everyone. Thanks for having me. This was really fun. You have such a great group here. I'm so impressed with the speakers you get and the community that you're building. It's very impressive.
Well, thank you, Dr. And just for everybody out there, our next monthly meeting will be Thursday, April 11th, 6 p.m. with Dr. Caldwell Esselstyn. If you'd like to receive notice of this and other upcoming PBNOW events and are not currently on our list, Google us at PBNOW, where you can subscribe and receive email notice of our upcoming events. Also, if you'd like to check out our past meetings, just go to the video library section on our website, or just go to YouTube under PBNOW, and you can go back and watch entire talks or skim through the parts of each presentation that may be of particular interest to you. Thank you again, Dr. Musial, for your sharing your valuable time and knowledge with us tonight. And thanks for coming, everybody. Good night, and hope you can join us next time.